truck regulation?
I don't think we need it.
What?
I don't think we need it. We're the only town in the United States that has such a regulation, to the best of my knowledge, but we'll see.
Sure.
Ready to begin in a minute? Okay, give us a countdown, we'll take it from there.
5, 4, 3, 2, 1.
Good evening. This is the monthly North Andover Board of Health meeting, Thursday, July 22nd, 2021, 7 o'clock. I'm Joe McCarthy, Board Chairman, and we have a quorum. To my far left is Daphne Alva. Floor.
Thank you. Hello.
To my left is Michelle Davis, and to my right is Dr. Matt Tilson. Also representing the department is Brian LaGrasse, he's the director. Steve Casey, the inspector. And you probably can't see her, but Tony Wolfenden, she's the administrative assistant. So meeting's called to order, and the first order of business is a pledge of allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Just a brief comment on the meetings going forward. These are live meetings. The virtual meetings have ended. Perhaps in the future, if a member or two of our board or any other board cannot attend, then perhaps they can be tied in virtually, but not at this particular time. The next order of business, mosquito control presentation. Now, North Andover has an affiliation with the Northeast Mosquito Control and Wetland Management District. And from that district, Kim Foss will be speaking with us, as she has done many times in the past. So the timing is really good because as of several weeks ago, the weather was brutally hot. And now it looks like we're going to break a record in July for rain. And there are concerns out there with mosquitoes. So with that, Kim, it's all yours.
Good evening. And let me start with a statement that we have. Recently, in the past few months, there's been a couple issues with products containing PFAS, which is a fluorinated plastic, well, polyfluorinated carbon substance. We wanted to make sure that you guys knew that we've done pretty diligent efforts for testing all our pesticide products to make sure that we don't have PFAS in them. Come to find out, it's basically the containers they're in, and PFAS is a substance that's used for multiple products such as food packaging, fire retardant materials. There's a list. You can go to the EPA's website and they'll give you a list of all the products that have it in it. But all our pesticides were tested to see if they contained any of it, and we haven't had any, and everything that we have has been cleared for use. So we don't have any of those substances in our products.
Excuse me, the PFAS, they are carcinogens, and they're considered to be, correct me if I'm mistaken, forever chemicals. They don't break down that easily.
Right. From what I understand, there hasn't really been a lot of toxicity studies on them, on the products themselves. So it's kind of like in this gray area, and different groups have brought them up. There's been a couple articles written about them and stuff like that. So until we know more, it's just nice to know that the state of Massachusetts and our pesticide board has done what they can to be able to minimize any risk, if there's a potential risk in the future, to be able to see if our pesticides contain that or not. So, and they don't. So due to the rain that we've had this year, I'm going to add this little slide to our presentation because we really need residents to check their houses around their house for any mosquito breeding areas. So this would be any standing water or water containers, anything that could have mosquitoes breeding in them, so it's standing water for 5 to 7 days. Bird baths, kiddie pools, tires, even check your gutters for leaves and debris. We've had a lot of storms and those can back up, and anything that has less than 6 inches of water can breed mosquitoes pretty frequently. Also make sure they check their screens for holes, repair those so they don't get mosquitoes in the house, and there's all kinds of things they can do to be able to correct that issue around their home. And it's kind of a fun thing for kids to do. They can go around and see how many activities they can find to dump the containers around their home. So the other thing I'll mention too is if you have standing water that's too large to take care of yourself, you can contact the district. I'll give you the website at the end, but you can go to our website, you can call us or go to our website, and we have a resident request page for larviciding and adulticiding. Andover Board of Health is the only authorization agency that allows adulticiding, so the residents can't request that. But as far as larviciding or checking your property, you can just send us or fill out the section or call us, send me an email, and we can go check your property, and if it has mosquito larvae in it, we can treat it with a larvicide, and that'll take care of the breeding. So people always ask us what we do, and if it's only a summer thing, what do we do in the winter? We pretty much do mosquito control year-round now, so a lot of our stuff can be done in the winter. We can still do larviciding and checking of wetland sites and things for certain species of mosquitoes, especially the eastern equine encephalitis mosquito, the one that's responsible for transmitting it to birds. We do check those habitats in the wintertime, but we also do a lot of wetland maintenance too, so ditches, culverts that need to be cleaned, all those other things we do over the winter months. We can do tire and recycling programs if they're available by the municipality. We usually bring our truck in and we can take tires from residents, no charge. They can't have rims on them. They have to be tires with no rims, and they're usually passenger or light truck. We do a lot of meetings and presenting information, and we do a lot of education in the winter. So we're pretty much busy all year round. So basically our district handles mosquito control as an integrated pest management approach, which is a combination of surveillance. We use chemical control, which is our larvicides and adulticides. We use a lot of biological controls, which is our bacterial larvicides, and we integrate that with physical control and education and outreach. So it's very important to do the education and have our residents be educated about how to dump containers and what they can do to prevent mosquito breeding in their area. One of our biggest areas in the district is doing our arbovirus surveillance program. So that's setting out traps on a weekly basis in all the municipalities that participate, and we collect the mosquitoes from the traps, and there's different traps for different kinds of mosquitoes, and we use about 4 different kinds of traps, anywhere from ones that carry West Nile to ones that carry Tripoli to ones that bite humans. There's just a whole bunch of different trap types. We collect those once a week, we identify them to species, and send them to the public health lab for testing. And that usually starts in May. We send them to testing in June. And we usually run all the way till the last week of September, unless the Board of Health extends the season due to high virus or temperature, like weather. They may extend for another couple weeks. But if we can't do any control, we usually stop testing, because if we get positives back and it's too cold to spray and it's really not adequate weather to do anything emergency-wise or response, we usually stop testing at that point. Also, we did change it. We used to notify you guys on Fridays, and I work double time now, and I get my pools back by Thursday, so you guys have the extra day. And that's me doing like extra time on Mondays, Tuesdays to get those in. You're welcome. So you'll see a map at the top corner, and that's pretty much where we have all these different types of traps. They're scattered about pretty much everywhere in the district. We also have Winthrop and Revere in Suffolk County. So we have 32 communities. So these are different trap types, so if you see them, please don't disturb them, because they're very important for us to collect these mosquitoes. Most of our sites are in secure locations. So we use these light traps with a CO2, which is a carbon dioxide gas, which is mosquitoes are attracted to it. It mimics human breath or mammalian breath. We use gravid traps, which are West Nile virus detection. So that's early detection. If we get a positive back in those, they're the ones that can amplify the virus from bird to bird. So if we get those, that means West Nile's coming. So we just got notified there's been a couple West Nile virus activities in Massachusetts, south of here. So we're on the alert for seeing more of those and then starting to test other mosquitoes that bite birds and people to make sure that we can control West Nile as we see it. So West Nile virus is a warm, well, a hot, dry weather type of virus, and it's usually in an urban environment. And Tripoli is more of a wet, cool, rural type area virus. Sometimes you get years where you get both. This may be, we're not quite sure, but we test everything, so we're making sure that we can prevent either one no matter what pops up. The other important thing that we do is larval surveillance. So we check all our larval sites, whether they are freshwater, saltwater, floodwater, artificial containers, natural containers, and we do our catch basins. So this ensures that if we see a lot of larvae, that we can treat them on time before they become flying adults. It's a lot easier to treat mosquito larvae when they're trapped in water than it is to wait for them to hatch out and become flying adults. So a lot of our work when we're doing control is larval surveillance and larval treatment. So we do general larviciding, which is pretty much all those sites that I listed before. We have a large aerial salt marsh larviciding program on the coast. Believe it or not, you benefit. If we get a lot of salt marsh mosquitoes, in fact, I'm collecting some now. We've had an overabundance of salt marsh mosquitoes because of the unusually high tidal events mixed with increased precipitation. We've had these marshes breeding all the time. And we pretty much treat these aerial, these salt marsh sites with helicopters. So to schedule a helicopter to treat those sites, we have to wait for the perfect moment. In the meantime, we get these small batches that let off. If we didn't do the treatments on the coast, we get these salt marsh mosquitoes. They can travel 30 to 50 miles on wind currents, and they just go everywhere. They come up the Merrimack, and we get them here. So we would see more and more if we didn't do that. So that's kind of all the participating municipalities are kind of under an umbrella, and everything that we do in different towns benefits everybody else because mosquitoes don't know town borders. So, and you know, with hurricane season and stuff, we even get mosquitoes from different parts of the country that can get carried up. So for West Nile virus, we do catch basin larviciding program. We do this very early in the season. We've already done your town. We treat these pretty early, and these are mosquitoes that bite the birds and can amplify West Nile virus from bird to bird. So the catch basins collect water. They're the storm drains with the grates, if you see the picture on the bottom. And these storm drains, they collect rainwater, and they're meant to dispose of the rainwater through culvert areas or pipes underneath the ground. However, there's still a sump at the bottom that stores water, and groundwater can leach into there. So it makes like a good, depending on how deep the basin is, it's a perfect place for mosquitoes to breed. And then you get birds hanging around, or urban birds. So the birds focus around areas where the catch basins may have floodwater around them or puddles next to them. So you get the birds that could be infected with West Nile, and then you get the mosquitoes that are right there on the street. So you get this whole little ecosystem going on of virus amplification. So if we can treat the basins early, we can kind of stop a lot of that. Now this is adulticiding. Residents cannot call in North Andover. However, we use these products for barrier treatments and ULV treatments, which is a truck-based adulticide for emergency response. And our barrier treatments that we do in North Andover are for preventative measures. We have a new product that we use, Suspend Polyzone, which can last up to 90 days. So this allows us to be able to treat these schools, parks, and recreation sites very early, as long as they have a vegetative border. And what that does is it's a broad spectrum insecticide that stays on trees, plants, and structures. So if mosquitoes fly through and land on them, it pretty much kills those. So it's just a really good product to use, and it gives us another line of defense as long as you're wearing repellents and stuff like that. But it gives us that extra line of defense around our areas that are public. The other thing we do is with both of these products, We only apply them a half hour after sunset. That protects pollinators. And we have a slight reentry, and it dries pretty quick. The poly zone, pretty much it dries within a half hour, depending if it's humid or not, but we'll put signs up. It's a very quick knockdown. And this is our adulticiding for ULV truck-based. We've done this here in the past for virus intervention. Usually it's either reverse 911 or there will be some kind of public notification that's made if we have to do a block spray for virus. And this is a ULV is an ultra-low volume product. So it's a fine mist that gets released from the equipment that you see. We use Zenivex E4, and it's a pyrethroid derivative. There's no PBOs in it, and it's highly effective. It's a very small amount. Usually I bring a little tube to show you, but it's literally 1 ounce per acre mixed. So it's 1 milliliter of active product for a football field. So it's very, very tiny amount of product. And its knockdown is quick, but it's limited. So you have to really apply it when you have mosquitoes flying around, because the droplets are so fine, they actually have to touch the mosquitoes in order for them to be effective. And it only lasts about 15 minutes. There's no residual, and the truck will only spray 300 feet total on either side. That, again, we do a half hour after sunset, and because of the label restrictions on it. And this is dependent on temperature, weather, and mosquito population. So if it's too cold, we can't use it because it doesn't have enough loft to carry the product. If it's windy or raining, we can't do it either because it's the same thing. We have to stop. So we have to fit these windows in for weather and everything. There's a lot of things that go on when we have to do a perfect spray. So this is kind of for you, not the residents, but we do have, we do outreach for school IPM programs. The schools are very important because we do treatments on them, but we have to follow the outdoor plan for 333, the Mass General Laws for child and safety protection. So we usually deal with, work with their school IPMs, and they have to update the plan every year, or if we add a product, they have to add that product to the plan for us to be able to use it. And that we have a new Board of Health liaison, Kelsey Liakos, and we have her contact information. She's already reached out and to the schools. We do that every spring, early in the spring. And we work with the IPM coordinators to add the products, make sure everything's current, and make sure that we can do our larviciding and adulticiding and barrier treatments pretty much very smoothly. Even though we don't do ULV treatments, residents, residents can still file a pesticide exclusion, and we have a few that have already done so in North Andover. What that does is, once you fill it out, it's online on our website. It'll take you right to the state's website to fill out the exclusion. Once you fill it out, it's a 14-day waiting period. It's for private property owners only. If you're a renter, you have to have the owner of the property do it for you. It's a ULV adulticide. And basically, the truck won't go near your house. So if we have a whole neighborhood where everyone wants a spray, or we have a block spray for emergencies, basically we shut off, pass by, and then turn it back on down the road. So you get excluded from that spray. For larviciding, it has to be greater than an acre. So to be excluded from a larvicide attempt, if you have a puddle in your yard and it's breeding mosquitoes and it's a really small puddle, we can still treat it. If you have a wetland out back, or you have a large area that's over an acre, that exclusion counts. So it has to be on your property. We also do property inspections. This is what I mentioned at the beginning of the talk. You can go on our website or call us, and we can come do a property inspection to see if there's mosquito breeding. We have pretty much access via Chapter 252 for Mass General Law, which allows us to enter properties. It's rare, but that's what we have. It also helps us when we have to deal with Board of Health for vacant properties or abandoned properties. So we have access to those to be able to treat them. We also do construction sites. So if anybody knows of any construction where there's open foundations that aren't being worked on right now, we can also treat those foundation sites. And we have a wetland management project person that also works with us. She's new. Her name's Caitlin King. And the only thing what we have to do with all these, with the wetland management, it has to have a mosquito component. We can't do it if it's just generally you want a new ditch or you want this. It has to be, you can petition the district using town letterhead. And when you come over, when you send that we go inspect it, we'll do a study to see what it has for mosquito breeding, what the potential is for mosquito breeding, and we can mitigate that along with everything else. So we have a contact for that too. And then we also do tire disposal events. So if you have a hazardous waste day, we bring the truck and we take tires. We also control invasive species, Phragmites, and it has to be areas where they're wet, submerged. They do breed mosquitoes frequently, and they are mostly vector-related mosquitoes. And this is our website. Whoops, kind of changed, but so it's www.anymassmosquito.org. And from here, you can access a lot of pretty much everything that we do for the district. You can see our annual reports, you can see towns reports, you can see budget. We have an integrated pest management plan that shows how we do our thorough page by page on different viruses that are endemic and invasive. Anything new that comes up, we have district announcements. We've got maps, risk assessments, pretty much what we're going forward to. We have past, current, and present in this integrated pest management plan. As you can see, we have our municipal toolbox link for the boards of health. We have a password that's password locked, so you can reach out. She's sent that also in the spring, but if you need it again, you can reach out to us and she'll send you the link for the password for that. On that, we have it separated by West Nile and Tripoli. If you have an event, you can, a viral event, you can click on that toolbox and it gives you public notifications, it gives you handouts, posters, all state resources. It basically walks you through and gives you all the materials needed to do public outreach during an event. And then there's our service request link. So right there, the other second red box, if you click on that service request, you can request the larviciding service. So far for North Andover, this was done in, I think, a week ago. We did start mosquito surveillance on May 17th. We submitted pools to DPH on June 14th, and we're submitting every week. We completed 24 site inspections for spring and early summer larviciding, and we're still in the process of looking for sites from rainwater. The rainwater events, we have standing water everywhere. So we did a lot of, while we were doing catch basin treatments, we carried a lot of products so that every time we saw a wet area, we treated it separate from the catch basins, so we kind of multitasked. We completed catch basin larviciding on the 1st, and we did a total of 3,700 basins. We do have 8 residential pesticide exclusions that have been filed, and we did a Board of Health requested barrier at the high school and a ULV, and we've got more coming the second week of August. And we've had only one resident request for property inspection. So we'd like to see a little bit more of those if we could, and that would help us control mosquitoes that we may not know where the sites are, or it helps us do outreach. A lot of residents ask us questions. Sometimes they're not there, but other times when I've done a resident request, it can be almost a half hour of just talking to the residents, and they ask questions, and it's a good outreach method too. It has been difficult with COVID, but we're still out there. A lot more people are seeing us because they're home, so don't be afraid to open the door and say, what are you doing? And then it gives us an opportunity to talk. So far, we've sent 12 mosquito pools to the lab, and all of them tested negative for West Nile and Tripoli. The symptoms for West Nile and Tripoli are usually fever, sometimes headache, stiff neck, flu-like symptoms. It's very similar to a lot of other viruses that are roaming around. So if you don't feel well, and it's in the summer, please go to your physician, because it could be a number of tick diseases, it could be mosquito diseases, or it could be a COVID disease. You need a COVID, but you never know. So, just make sure that you visit your physician. The other thing is, if you're going to be outside recreating, especially with all the rainfall we've had, please wear repellent and dress appropriately to avoid mosquito bites. Questions from the board?
Thank you. You did mention we do work with Mosquito Control on a regular basis. We do have some targeted sprayings coming up in the beginning of August. basically to get ready for the fall sports seasons and all of the nighttime activities for sports and schools and the youth leagues and things like that. So we do try to be proactive with this. Kim, you're great to work with. It's been many years now at this point, which is fantastic. We did do one public outreach campaign for all the standing water, protect yourself, empty the pools in your yard, standing water, things like that. So we've done one outreach already. We should do another one on the property inspection. I didn't add that into the last one. We should definitely do one coming up to help you guys get more property inspections going on.
Yeah.
We can work on that this coming week, and we can get that out hopefully next week.
Yep, and we did drop off some materials that the state provided.
Yep.
So those can be available for pickup by people.
Thank you.
And if you need more, just send us the information
Mhm.
and we can give them the address to mail them to you free of charge, so.
Perfect. I don't have any questions. That was just a statement, but I'll let you guys.
What's a
Okay.
triggering event that you send, you said there, is that when you find an infected mosquito, or what is considered a triggering event?
So we have the traps on a weekly basis, and I look through them, and depending on where or when the virus is in other parts of the country and the state, so I track the virus is coming. So for example, West Nile virus, we've had some positive pools in other parts of the state. When I track, or even when Connecticut gets their first one, I time it, it's pretty close. So we collect mosquitoes, and when I look at them and identify them, I look to see if they're blood fed or if they're full of eggs. And I only send the ones that are primary vectors at first. So the first part of the surveillance season is sending the amplifying species, so the ones that could trigger bird populations for the virus to get amplified in birds. And what that means is you may get one or two birds that come up from the south that are infected. They roost and nest, they get bit by mosquitoes. Well, those mosquitoes that only bite birds will feed on those and then go feed on other birds. And then they feed on other birds, and all of a sudden, instead of 2, now you have 100 birds that are infected. And then a month goes by, or a month and a half goes by, and then I have to start looking and sending in the other mosquitoes that bite birds and people. So those same mosquitoes, so a mosquito bites or feeds, it doesn't die. It can lay eggs and go feed again and go until it dies eventually. But so that same mosquito can get infected multiple times with multiple viruses, and it can feed on multiple hosts. So we have to kind of look for signals in the population changes or what we're seeing for viruses in other areas of New England, that type of thing. So that's part of what I do. Is I've been doing it for so long. There's certain things, weather components, population densities of mosquitoes, where I'm finding them, and it can change on a weekly basis. So making any predictions is extremely difficult. But we look at a lot of past data all the time, and I get information on a daily basis from other parts of areas that have the same issues going on. So we're in conjunction and communication. But yeah, it's picking and choosing which ones I send and which ones I don't. So.
Great, thanks.
So positive pool, or a human case diagnosed, or even a positive animal, such as a horse.
Okay.
If we get a hit on one of those, then that
The truck goes out.
creates, okay, what's our action plan going to be to take care of this? And there are different steps and different things we can do, but targeting spraying areas, things like that, is usually one of the first steps. I don't know if you've ever done.
Well, yeah, if I
townwide
get a
spraying in
hit off
long
a trap,
time.
so I have historic traps that are placed, and they're there every year. If I get a hit on one of those, a batch of mosquitoes that comes back positive for anything, depending on what the species is or the virus that's responsible, then I set out supplemental traps. So then there's areas I have around the town that I know where the breeding site is for those species. So then I set out these other traps all over. And then I send those mosquitoes in, every single one of them, and I send them to the lab for testing. And that pretty much gives us what the risk would be in the area. That's without a human or a horse. I mean, we hope we get mosquitoes first. When we had the Tripoli events a couple of years ago, it was unfortunate, but we had horses first, or we had a couple of human cases in the town first before we even had the mosquito. So we try to cover everything, But there's a, so we got the regular traps, and then we set out the supplemental traps to see if we can get a hit. And then if we get a hit in those, then we schedule a block-wide spray around the area where we collected that mosquito and the habitat that it associates. And we try to do small blocks so that you may not have those habitats in other areas. But we'll send out supplementals in those areas. So we kind of chase these viruses around. And usually by the time we get done with these small blocks, we don't get reoccurrence of the virus in those areas that we treated. If we did a citywide, it takes a lot of resources to do that without really knowing if the mosquito's even in those areas. So that's where the supplemental traps come in, and the little tiny targeted areas, because we can do a little target and then leave and do multiple municipalities at the same time.
Kim, are there any other diseases that we should be concerned with other than West Nile and Eastern equine
There are,
encephalitis?
yeah, there are, but the state currently is not testing for those. I'm assuming that you're referring to like Maine and New Hampshire there with,
Well, I just know that there are a number of different types of mosquito-related diseases other than West Nile and Eastern equine
yeah, I mean,
encephalitis.
there's
And-
some that circulate around endemically, and there's, Jamestown Canyon, those type of other mosquito-borne viruses, but they're not as big as the West Nile Tripoli, but they are out there. So, you're never going to know which mosquito has what. So basically, the repellent usage and the personal protection methods, it's just like ticks. Some ticks carry it, some ticks don't. Unless you know which tick carries Lyme, you should wear repellent, because not everyone can identify a deer tick versus a dog tick. Same thing with mosquitoes. You can't identify one mosquito from another just by looking at it. So the best thing to do is wear repellent to cover ticks and mosquitoes.
Other questions?
I just wanted, I'm curious about the wetland management, because I do personally, I have wetlands right behind, so I just want to know what does that entail, and if we're interested in, how, I know how to contact you now, but just wanted to know a little bit more about wetland management.
The wetland management is usually, for us, it's clogged waterways that can build up and flood, and it creates mosquito breeding. So we can usually, sometimes we'll do manual ditch maintenance. So while we're out doing larviciding, if we see a clogged ditch for leaves or sticks and stuff that backs up and can flood lawns, we pretty much manually hook it out, clean the culvert, and then move on. Our mechanized, which we use equipment, that's for larger projects, like if we wanted to, say you wanted to redivert water that's flooding in a municipal area, work in conjunction with the DPW, and we can get that water flowing in a different direction. We've done retention and detention pond cleaning type of thing, if they fill in with silt or if they grow trees in it. I mean, usually retention and detention ponds have a specific purpose to collect water and drain it quickly. They should be mowed and maintained, but sometimes they don't, and they turn into other types of things that, and then we have residents sometimes that will throw things over. So we have to clean out debris out of them, like Christmas trees and you name it, But we are limited to a small amount of that kind of ditch maintenance, or it has to be mosquito component, and we have some heavy equipment, but we're not a large construction company. So a lot of our stuff, we work hand in hand with the DPWs, the Public Works Department, to mitigate smaller problems that might be mosquito management.
So if a town resident's going to have a party and is concerned about mosquitoes,
They should,
contact your district.
I'm sorry?
Contact your district.
Yes, contact our district. And we can answer questions and try to help you out the best way we can.
Does your website also have information for people who are looking to do independent spraying, or what to look for in a partner for that, or anything like that?
We don't. They can call the state's pesticide board, and they, on their website, they also have a list of licensed other, usually alphabetically, of other people that could do that. Other companies that are licensed to be able to do your home
Individual
spraying. Yeah.
Other questions? Thank you, Kim.
Thank you.
Thank you.
Good
Pleasure as usual.
Thank you.
Annual mosquito presentation, Kim. Thank you. Appreciate it.
Communications, announcements, and discussions. COVID-19 update. Brian, all yours.
All right, back to this again. All right. We are right now looking at about 10 to 11 cases. I think one of the cases just came off today. We're back to seeing a couple a day. So we were at 0 for several weeks in a row, which was great to see. But it's starting to creep back in a little bit. I think one of the things to note is that the majority of cases we're seeing are people that are not vaccinated. And it essentially goes back to the beginning of the pandemic when nobody was vaccinated. Everybody was out and about doing their regular routines, and the virus came and started going through the entire population because nobody was vaccinated. Then we shut down, implemented social distancing, closing businesses, mask mandates, and it kind of stayed everything off for a while. It slowed it down, and you flattened the curve. Now we get the vaccine campaigns rolled out, and things started to open back up. So basically what's happening is the people that aren't vaccinated are seeing what we saw pre-vaccine. So the cases are coming back up again all across the country. Massachusetts is still relatively low in terms of overall numbers. We had 457 new cases yesterday, 1.3% positive testing rate, and 477 new cases today at a 1.39% positive testing rate. Luckily, anybody who's vaccinated, if they do contract the virus, it's called the breakthrough case. They are very few and far between, but we are seeing them. Are getting very mild symptoms, if any, and are being tested for other reasons, whether it's going in the hospital for another procedure, or traveling, or they know somebody was exposed, so they go and get tested themselves, or they have symptoms, and they go and get tested as part of their routine testing for various viruses. COVID-19 is a standard test now. So right now we have 111 hospitalizations in Massachusetts, which is still far beneath the 4,000 we had at one point last year. So the people that are getting sick through breakthrough cases is very few and far between. I think out of the 5,000 Massachusetts had, there was 300 that were hospitalized out of the 5,000 breakthrough cases out of 4.3 million people that were vaccinated. So the numbers are very, very small percentages. The news is talking about it because it's happening, but I don't want people to get scared thinking that everybody that got vaccinated is now going to get COVID again. That's not the case. So right now, North Andover has 69% population vaccinated completely, which is a fantastic number. I think Massachusetts is above the national average. I think the national average is 56%, somewhere in that area. So we're far above that, which is really good.
Is that 69% of the residents or 69% of those eligible to be vaccinated?
The residents. So
So under 12 included.
under 12 included.
Okay.
So as a town of over 30,000 people, 69% have one dose and 64% are fully vaccinated. So over the next couple of weeks, the 64% will go up to the 69, almost 70%. We have seen a die-off in the vaccine uptake. So the three age groups that were of the biggest concern were 75 plus, 65 to 74, and 50 to 64. But they're at 95% and 88%. 75 plus is 95% one dose, 88% two doses. 65 to 74 is 93, and then 89 with one dose. And 50 to 64 is 84% one dose, and 80% two doses. So those numbers are really high, which is really good, which brings our average up for the 0 to 12 or 0 to 11 that can't get vaccinated. However, those haven't changed in a month. So I think that's going to stay status quo for a bit. If they haven't gotten it by now, I don't think they're going to. If they're, 65, they've made up their mind already. No matter what the issue is, I think we're going to see those numbers kind of level off. The younger groups, we're seeing them slowly tick up a little bit, but those have also been kind of plateaued for the last few weeks as well. So 30 to 49 is 80% one dose, 75% two doses. 20 to 29 is 73% one dose, 66% two doses. So it's still up there. And then as that ticks up, obviously our averages go up, but the 16 to 19 age group is at 64% and 58% fully vaccinated, which is pretty good. And the 12 to 15 age group is 73% one dose, and 57% two doses. 0 to 12, they're still working on. I have heard, and you can correct me if you've heard anything different, Pfizer's looking to go to the FDA for emergency authorization use probably sometime in September, maybe October, which then will be a short turnaround after that point to get the emergency authorization from the FDA to start doing the younger age group. And I believe that is 5 to 11. Moderna and Johnson & Johnson are also going to be going for it as well this fall. I didn't see any dates on them yet, but they're looking late fall, early winter, or even the beginning of 2022. But so it's moving slowly, a lot faster than it would have in the past, but definitely faster than previous vaccines, which is to say that they're really kind of all hands on deck with this one still. Have not heard anything about boosters. I don't know if you have as well.
Only that they're not indicated yet. They haven't, the people protection still lasts well into what we are seeing in terms of when people have been immunized, so they're not authorizing that, they're not
Okay.
boosters yet.
I've heard that too, that the immunity isn't waning
No.
as fast as they had possibly thought, which is really good. So, and if we can keep that up and people are still immune, getting the younger populations finally approved will help kind of squash this next little bump that we're seeing. And they're doing studies right now in Spain, Poland, Finland, and the U.S. Thousands of children are in these trials right now, so they're collecting a lot of data, and it's going through that data and getting it presented to the FDA. So Mass has 4.3 million people fully vaccinated, which is out of 7 million people is really good. Obviously, the variants is the talk of the town at this point in terms of everything you're hearing in the news. But like I said, the vaccine does cover the variants that they've talked about, even the Delta variant. It's not more severe than the original strains that we had already come through, so it doesn't have a higher mortality rate. So it's not more severe, it's not more dangerous. They say it spreads easier, but it's going through, like I said, the unvaccinated populations, which it spread like wildfire when nobody was vaccinated in the first place. So I think it's just consistent with that. I don't know if you know anything else about the Delta variant and what they're saying or what you're
No,
hearing.
exactly what you said. It's more infectious and it's not more lethal. So it just is more. It's easier to get.
Yeah.
So that is what it is.
So I guess we want to try to encourage everybody to get vaccinated. If you know anyone that's not vaccinated, tell them to get vaccinated. It's vaccines everywhere. You can go to any pharmacy in town here and they have the vaccine available. Some are by appointment only, some you just walk in and they'll accommodate you. So the CVS here on Main Street, Walgreens on 114, both have it. AFC on 114 has it as well. So if you know anyone that hasn't gotten it, encourage them to get it.
Do people
Because-
have a choice as to what vaccine they can get?
For the most part, yes. If you call around, most places have multiple vaccines. So maybe not all three, but if you call around to enough places, you can find the one that you want. And they're still testing at Lawrence General. They still have their drive-up site. So,
Still do pre-procedure testing there.
Yep.
They still do.
yep, and I hear they are catching people with asymptomatic symptoms at
Yeah.
the pre-screenings, and I actually had a friend of a friend that got it, didn't know it, went to go for a procedure, and is now in isolation.
Yeah.
So, yeah, tell everybody to get vaccinated. That's our latest push, right?
I had read that people that do have the virus, it's predominantly the Delta right now. And you mentioned breakthrough cases, that is people that have received their shot or shots and still come down with the virus. It's like the number I saw this morning, it's 0.1%, which is basically 1 in 1,000. And those people that come down with the virus, it's typically an upper respiratory problem similar to the flu. They don't end up in the hospital. They don't die, but then again, there's always exceptions. So
Yep.
So if you have it, you know, even though you've been vaccinated, should be okay.
So we're still doing our conference calls with DPH. They didn't do it this week, it was canceled, but we do it every Tuesdays. So we still get information, they're still talking about it. Obviously, there's a lot more talk now that things are starting to bump up a little bit. I don't think anything's changing at this point. I think still our numbers are still so low, there's no reason to start talking about mask mandates again, or lockdowns, or shutdowns. I think with the number of people we do have vaccinated and the low number of hospitalizations we have across the state, I think we're looking at a pretty good situation and scenario moving forward with more people getting vaccinated, and then the grade school kids being able to get vaccinated as well.
Well, speaking of masks,
Mm-hmm.
there was an article on the front page of Tuesday's Boston Globe. And as I said in the past, bad news sells newspapers, and
Headlines.
don't believe everything that you read and everything that you hear. But the article said that pediatrics, there's a pediatric group, calls for masks in schools. And it says a top pediatrician group is calling for everyone older than age 2 to wear masks in school this fall, even if they have been vaccinated against COVID-19. And this is verbatim. The American Academy of Pediatrics recommendation contradicts federal guidelines and drew immediate rebuke from some parents, while a teacher union leader and some academics praised the idea. So basically, what this group is saying is wear masks in school, and the CDC says as of today, no. So what are you to believe? There's so much conflicting information out there. And my feeling is, well, if the pediatric group, if they can back up their school mask recommendation with hard data, which should also be available to the CDC, then let's see it. I looked around, I haven't seen it. I'm not saying it's not there, but we're getting conflicting information, and it's really hard to get the truth. It could very well be that going forward in schools, they may say, well, it's up to the parent. If the parent wants a child to wear a mask, then fine, but then again, you have one child wearing a mask, another child not wearing a mask, and that's going to lead to all kinds of chaos in the school if that happens. So it appears, particularly with this new Delta variant right now, that I would not be surprised if the CDC says going forward, well, you should wear a mask in school. But right now you don't. So it's just a mess. It's a mess. But any comments on that?
So I think that just shows that the Academy of Pediatrics is very conservative, and they don't want the kids to get sick. So they're being conservative and saying we don't know what the long-term effects of this virus are on children, and we know that you're sending unvaccinated people into a very close quarters without any distancing between them. And if you were doing that with adults, you would think we're crazy. So we're going to protect the kids until we know what the long-term effects of this virus are on them. And they're the last reservoir of the disease. So
Well, the data that they're looking for is basically the same as the CDC has, but they're saying two different things. And again, I'm not even sure if they have data.
well,
It just may be a concern that they have.
right. They have data on the virus spread among unprotected groups. So they haven't had. We have never told people who are at risk of an infection to go into a closed situation unprotected before. And so what these guys are saying is that you're sending kids who are unprotected from an infection into an area that we know is a risk for the dissemination of the disease. And they would argue, they would suggest not to do that.
Well, at this time, at least as of today, there aren't any restrictions concerning the virus. School this coming fall, but then again, that may change.
No, but my kids are in North Andover youth activities that are in and out of the schools right now. One of my children is vaccinated, one is not, based on age group. And I think the town is still leaving it really in the parents' hands of
and recommending masks, especially for the younger kids, the elementary school programs, and masks are required on school buses for any of the transportation that is happening in town, and I think they've been very open and said, you know, indoors are still recommended for masks if possible, and then outdoor activities. So I find that even now, like right today, my kids are, you know, still being given some, in my opinion, you know, consistent guidance with that for the unvaccinated children who are going to be indoors in close proximity or in buses to wear the mask. So to me, it hasn't changed much, at least in town, from spring in school to what I'm seeing today for unvaccinated. Yeah. So I guess I say that if they said elementary kids, if September and October is going to be when we may see vaccinations, I would be okay with them saying your child's not vaccinated going into a big indoor building with all these other kids who can't be vaccinated. Like, guess what? We're wearing masks.
That's what Desi might say sometime next month.
Right.
It wouldn't surprise me.
It wouldn't
Yeah.
surprise me either.
Right.
The governor did say that he's not instituting any more, currently, as of today, he's not instituting any more restrictions or mask mandates or anything at this point moving forward. He wants people to get vaccinated. Obviously, the kids that are under 12, 11 under, can't get vaccinated, but in general for the state is not indicating any type of rollbacks or lockdowns or additional requirements at this point. So that can change on any given day, as we know and as we've seen for the past year and a half. Let's see what the numbers do, see what the virus does, and make adjustments and make decisions based on what we have at that time. So I wouldn't be surprised if they do make some decisions in the next few weeks moving ahead for fall school. I don't know what that means for sports or anything like that, but we will play it by ear and see what the data says.
Speaking of data, I also read today that in the country there has been 335 children under 18, I believe under 18, died, and they had the virus. It doesn't mean that they died of the virus. It's just that they had the virus when they died. Could be a comorbidity issue. I don't know. So, population of the country, 335 children under 18 died. Is that a concern? It certainly is for the parent. I mean, it's disastrous. But the number is low, and the number is so low, does it warrant further restrictions? I don't have that answer.
I think you have to decide what you're worried about. If it's just death you're worried about, then probably not. But I don't think that we know enough about this
Yeah.
virus to know what the
Yeah.
long-term effects of this thing are.
Yeah.
And so if I had a kid that was under 12 and unable to be vaccinated and was an athlete, and they got this thing and then started to have some heart problems because of that, I would be really upset. So I completely understand why a pediatric group would come out on a conservative side of this. It makes a lot of sense to me. We just don't know about the long-term effects are myriad, and we know about long haulers. I mean, that's a real thing. The autoimmune changes that people get with long haul disease are not inconsequential, and you don't want a kid burdened with that for 30 years unnecessarily, just because they don't want to wear a mask, waiting to get vaccinated.
Anything else, Ryan?
Yep, very well said.
I can say that
I'm not going to argue with the physician.
I'm a gastroenterologist. I'm not an infectious disease guy, but I can tell you that the uptick in I've seen a lot of hand wringing over the uptick in the percentage of positive cases that have been coming. Because remember, for a long time we were sub 1%, and everyone
Yeah.
was applauding that,
Mhm.
and now we're sort of creeping up to 1.3%. Is a high number. The goal was always to be under 1%, and
Yep.
when we crept above 1%, I saw a lot of people start to get very concerned
Yep.
that we were having breakthrough cases. And I think you have to remember that when we were sub 1%, we were testing everybody for everything all the time.
Yep.
So everyone who got any sort of elective procedure, anybody who traveled to Maine, all got tested. So we had a ton of people who were not getting tested and were getting negative tests. Now the people who are getting tested, not pre-procedure, because the only place that I know that does that now is Lawrence. Everyone else has stopped. Not travel unless you're going to Hawaii or Europe, and even then, I mean, not many people are doing that right now. So the people who are getting tested are people who have symptoms, so you're gonna have a higher hit rate on that. So the 1.3%, I don't like, but I'm less concerned about it than I was before.
Like at the beginning of the pandemic, when there was very little supplies for testing, they're only testing symptomatic people, so we had a 40%
Right.
positivity rate, which is super high, but when you're only testing people who are sick, that's part of the process.
Yeah.
But yeah, they still did, I think, 75,000 tests yesterday.
Yeah, they do a
So they're
ton.
still doing a ton, not 200,000 like they were doing 6 months ago, but they still do a good chunk of tests across the state, which is good. So it is almost 4% at this point, so it is creeping back up, which is definitely concerning. And now we have cases again in town, which we were at literally 0 for like 3 weeks in a row.
Yeah.
I was so happy.
I know, I'm sure.
That's all I have for my update. I guess I can pass it off to Steve over here, just to give a general department update.
Yeah, so for the most part, it's really been a lot of septic inspections. Again, with either the housing market, everyone's getting Title V inspections, and if they're failing and they're trying to sell the house, they have to basically repair or upgrade the system. We have been doing some housing inspections too. Mobile food is starting to pick back up too, just because with everything opened up, there's events going on at like Stevens Coolidge, for example. We're still doing a decent amount of permitting. We always have building permit sign-offs, but here and there, again, with events, we do like catering, the mobile food permits and things of that nature. And then just a lot of just fielding questions and inquiries. Again, a large chunk of the last, I'd say, month-ish have revolved around septic, with people selling their houses. They want to know the process for if they're selling, does the system have to get replaced before they sell it? Can they do, they call it like putting money in escrow to basically pay for the repair and still be able to sell the house before it's finally in the ground. So that's just my quick update, but yeah.
Steve, how many septic systems are there here in North Andover?
I don't know off the top of my head. There is a fair chunk of town that's on sewer, but I would say that's more concentrated towards like downtown for the most part. There definitely is a lot on septic though. As for permits, I'd say we only have about maybe around like 10 open right now, but that's only ones that need repairs or new constructions or things like that. It's hard to give like a number, to be honest, off the top of my head.
There's definitely several.
But you're busy.
Yeah,
Yeah.
I'm sunburned.
be-
Sunburned for a reason.
On the 3 days we did.
Yeah.
Yeah, out country's mostly septic. So you're talking, I think there's 14,000 houses in town, or units, so multifamilies and single families combined. So you're probably talking a good 5,000 on septic still.
Bill?
Yeah. Most of like Salem Street,
Salem
Johnson
Street, John Street, Foster Street, Winter Street
Yep.
are all on septic still. The watershed around Lake Chickawick and even out onto like Dale Street has all been sewered. But the further places that don't have access to that are all on septic, obviously.
And speaking of sunburns, the sunscreen dispensers are up too.
I was just gonna say, there's.
Yeah.
Yep.
So.
Yeah, so those are all up right now. I think actually minus one. One's broken. It's
Yep.
on my desk. I'm trying to fix it. That's it for those updates.
Rental housing program?
I just finished a rough draft of a rental inspection program that we talked about for a few years. They tried to do something here years ago, but it didn't end up ever getting passed. I think there was some political opposition to it. I want to try again maybe, but I gave you guys, it's a 2-page copy of just a quick little rental inspection program we want to implement. Basically, it's just a pre-inspection of a rental unit before it gets rented. So in between tenants, call us up, we come out, we do a quick inspection, note any deficiencies or violations of the housing code before you get a tenant moving in there. It's pretty simple to do, especially when there's nobody living there. It's a quick, easy inspection. You can see things pretty clearly versus when it's all packed with furniture and stuff. But just make sure it meets the housing code. Just basic stuff. It's like life safety things, railings, smoke detectors, carbon monoxide detectors, heat, hot water, gas, no broken pipes, no leak, no water stains in the ceiling, you know, basic stuff, but if we can nip some of the stuff in the bud, it will save us in the long run in terms of major housing issues and condemnations and things that we see from time to time.
Is this something that, and I think it's a good idea, can you do it unilaterally, or do you have to first pass this? Because I haven't read it yet, I just got it.
It's really quick and easy, just a rough draft. I've had this in other communities that I've worked in. You gotta do the regulation and have the policies first, regulation, application, and then once we get the program running, we'll start doing the inspections. But I wanna make sure you guys are on board with it before I pass it
Absolutely.
upstairs.
Absolutely.
I think it's
And
great.
go to
Yeah.
any other boards or commissions at this point, but
I think it's great.
thank you.
So basically, we have it. We'll
Take a look
take
at it.
Get back to you. That's it.
Yep. Yeah. I wanted to get it to you last week, but it just didn't happen. I'm sorry.
That's great.
Needs assessment update?
So as we spoke last meeting, I had already spoken to Health Resources in Action prior to the last meeting. I did have a Zoom call with them the other day. That's one organization that does this for the hospitals. They do it every 3 years for Lawrence General and Holy Family. So I had seen them do this before. So they did it for Worcester, prior to Worcester's Health Department getting accredited. And I said, you know what? Let me give them a call. Talk to them. They seem very enthusiastic about it. It's a little bit different than what they usually do in terms of hospitals in their catchment area and larger areas, but I want to focus it on North Andover. So I talked to them, got a few of them. They're going to get me a proposal. They're more of a consulting company that's a quasi-governmental agency, and they do this. I think it's a nonprofit, but they still have to charge and do all that kind of stuff. So went really well. I also spoke with Max's friend Andrew Yolk, which is Finding Common Purposes. And do you want to talk about a little bit about what he does and
Yes, so find a
our
common,
conversation?
yeah, so in full disclosure, Andrew's a friend of mine. I've known him for 25 years, so that's the first thing. He used to be a consultant, and he had an organization called Root Cause, which was looking at root causes of underlying societal issues to try to figure out what made things not work. His big frustration has always been that you throw a ton of money at a problem and nothing ever really changes. And so he says there's a ton of money that's out there in progressive social policy, but when you step back and look at the real outcomes that those things have affected, they're not very impressive. You know, cities and towns throw a ton of money at issues. And so he's really trying to help communities drill down on what key issues there are and then hold them accountable to it, hold them accountable for it by using dashboards and progress sheets that are public for everyone to see. Sort of here's what we've decided as a community are the main issues that are driving our health or our societal problems, and here's what our goals are, and here's where we are, as you said, moving the needle towards fixing those things. So he believes very much in integrated community assessments, so getting buy-in from major stakeholders around, including schools and the elderly populations and everybody who might be affected, have them get all into a room and work for a long time to figure out what are your 3, 4, 5 major issues, and set realistic targets about how you're going to fix those, and then develop programs and make small changes and assess it, and then make more small changes and assess how you're doing to get to the underlying root causes of those problems.
Well,
Yeah,
with,
fantastic.
you know, with our health department taking the bull by the horns, it's quite, I think it's quite impressive. What's the timeline on this need assessment program?
So when I talked to HRIA, they basically said they can get me something in terms of a plan to start probably in October, late September, early October. Speaking with Andrew, we may do a combined call next week with Andrew from Finding Common Purpose and HRIA. Andrew's a one-man show. HRIA has a full staff. But I want to do these community assessments. I want to do public outreach, stakeholder meetings, community involvement in surveys to get the feel from what the people think they want, what they think their needs are, and then work with Andrew, maybe prioritize those and come up with action plans. If we can find out what the priorities are, itemize them, and prioritize them 1 through 5, start the process. Well, we got to get all the data, collect everything, meet with everybody, and compile it all, and then come up with those priorities, and then action plans, and then implementing those action plans. So it's a long process, but I want to start it now and get everybody on board, come up with this assessment, find our priorities, and then implement programs and actions to address those needs. So probably about a year for the planning phase of it. The survey and start the planning process, and then implementation after that. So you're talking a good 5-year project would be my estimation on actually being able to measure some outcomes and see that needle actually move from priority 1, 2, 3, and 4 all the way down towards the outcome that we're looking for.
So initially, we're looking at this from the perspective of the Department of Health.
Yep.
But it appears that it can help our town,
Yes. Community.
could help
The entire
our
community.
community, could help.
Seniors. Mental health issues with adolescents. Substance abuse. Health disparities and equities. Right on down the line. If there's a population that is very close-knit, that they don't do a lot of, if we don't reach them or do a lot of outreach to them, they don't know we're here or the resources that are available, they might not try to seek that. So if there is an immigrant population that comes in that doesn't know we have A, B, and C available, until we tell them, this is available for you guys. If you guys want it, you can have it. Like, oh, okay, great, thank you. Food insecurities was huge throughout the pandemic. Like, I had no idea it was going to be that big. But we had the entire food bank and food distribution process that we set up through the schools and the library for the better part of a year of people that couldn't put food on their table.
In North
So-
Andover.
Yes. So,
Would these, like,
Scary.
would it be translated in other languages since you're saying?
Absolutely.
reaching out to
Yep.
the community?
yes.
This
So-
is awesome.
It's incredible. I think
Yeah.
that one of the biggest things that I've been thinking about this is when you get a third party organization to come in and tell you what your needs are, I don't think you're going to get a ton of community buy-in to that. I mean, it just doesn't resonate with me to think that someone who doesn't know this community is going to come in and sort of do the 10,000-foot view of it and say, oh, your problem, here's your problem, and here's how to fix it. I don't think that you're going to get much of the community rallying behind that.
Yeah, I want the
strongly.
community involvement in every step of this. Selectmen, Council on Aging, obviously you guys as the Board of Health, and then even I haven't told them this yet, but even the school nurses, they've got their pulse on those students
Mhm.
better than anybody.
Does our high school do the state risk survey?
I'm sure, yes, yeah. I know Cheryl does all of that stuff, and she's got her priorities, and she's got her surveys, and she's got all that data that we're gonna tap into.
Yeah.
Yeah,
I think one of the good news is we're not the first people to do this.
correct.
And so we don't have to invent this process. This has been done many times in many communities, and we have the privilege of having an enthusiastic group who's going to be able to go look and see what other people have done and what's worked and what makes sense for North Andover. What makes sense for New York City probably will not make sense for North Andover.
Right.
But there are
And-
going to be pieces of it that will.
Yep. And what makes sense for Worcester might not make sense for us. And even talking with HRIA that did the assessment in 2019 for Lawrence General said a lot of the surveys they did, a lot of focus groups they had, and they did focus groups, were all based out of Lawrence.
Mm-hmm.
And I said that skews the data for their entire catchment area towards one specific population, one specific city, whereas we're the city next door that has a different base. So skewing it and seeing what we can do here as a Board of Health and as a local community, I think, is having that focused survey group and surveys and focus groups and all the information for us, I think, is.
You also have to look at what the HRA, if the HRA customer is Lawrence General Hospital,
Yep.
then they're going to ask very different questions than if their customer is
Correct.
the town of North Andover.
Yep.
Those are very,
Yeah.
very different. It's very,
Yep.
They're going to say, you as the Lawrence General Hospital, everybody needs to get a colonoscopy. Number one most important thing that might not be the most important thing for the town of North Andover.
Yes.
Well,
Yep.
having
Yeah.
done the risk assessments for hospitals for many years, it's really to help them figure out where to spend their money.
That's right,
And so
yes.
they are gonna look at, like, Lawrence General's gonna look at Lawrence as,
Mhm.
probably, like, just in comparison to their other their other
Yes.
communities on where should we invest
Yeah.
our funding, where this is not about funding, this is about the need, so
Yeah.
you're coming at it from an angle that's not about writing checks, but
Yes.
really about
So this
solving
is the
problems, which is
focus
great.
on the needs assessment, I think is the key phrase here.
Yeah.
But I've never researched this before, so talking with HRIA and hearing Worcester talk about it, and then talking to your friend Andrew, I think we can come up with a really good roadmap. I think Andrew knows the root cause and how to address it. And I think if HRA can help do all of the data collection and set up some of the focus groups and surveys, it could be a good meld of services, and we can come up with something really good.
Some of the words that you just mentioned, seniors, food, and so forth, just thinking here, in North Andover, obviously, I'm in a relatively affluent community, but 19% of our seniors live below the poverty level. 19%. And typically those elderly women who are widows. Our community does a lot for people as such, but that number is
Shocking.
yeah,
Mhm.
yeah.
Yeah.
It's but with council on aging, the senior center, director, department, of elder services. A lot is done for them. But I just say, why does this happen though? 19% living below the poverty level in North Andover. Scary. And you mentioned opiate too. I was reading that this year, compared to last year, the deaths from opiates has increased I think it's like 22%. 22%.
2020 was a pretty bad year, Joe. It was not a good year on any metric.
You know what
Just
surprised me
because it
though?
wasn't on the newspaper headlines didn't mean it went away.
That surprised me the most, that you didn't hear anything about it.
Nothing.
Jeff Duchesne from the fire department does a monthly report for us, and I always look at it, but it was never in the news. There was no headlines. It was completely absent. And a friend who said to me the other day, shocking that this wasn't being talked about all last year, and now we're hearing about it now.
Yeah.
Yeah, it never stopped. It just,
No, it never stopped. It was just not talked about.
And the number is staggering, the deaths. I just don't know. I don't recall what it is, but certainly I believe it's approaching 100,000.
Yeah, it's horrible.
Mhm.
I mean, I know several young people that have died
Yeah.
from an overdose. Wow.
Back to the assessment, if you need any help, I'm very
Yes.
passionate about this. If
Great.
you're
Really?
looking for, oh yeah,
Great. All right.
just sign me up.
I have 2 board liaisons now. You and you. Great. Awesome.
Anything else?
That's all I have for tonight. I
Well-
think Tony might have something. No? Okay. Just checking.
Well,
Do we
before
need to talk about
we,
the August, do we need to formally talk about the August meeting?
Oh, yeah, you can maybe.
well, barring the unexpected, there's not going to be an August Board of Health meeting. This has been a tradition for many, many years. But then again, the unexpected does happen. So right now, there will not be a Board of Health meeting in August. And before we break, just a quick comment. As mentioned, this will be my last year as chairman of board, and I've been on this board probably as long as all other 4 members. So it's time to move on. I spoke with our town council, Suzanne Egan, and I said, if other board members, could they conduct a meeting? And she says, you're the chairman, it's up to you. And I said, really? And she said, yeah, have them conduct a meeting if they want. And of course, at times like the chairman is not present, then the clerk conducts meeting. So I'm saying that if you have an interest in conducting a meeting or 2 over the next, the fiscal year ends July 2022, and then I'll be speaking with you, vice versa. And I think it'd be good experience, and I'm very impressed with all the members of the board, and would like to see you fill in at one time or another. I don't mind doing it.
I'll do August.
I don't mind doing it, but I like
Stole
to
my
see you all do it. That's good. Wow, that's an interesting way of ending the meeting. And at that, I think we need a motion.
I'll make a motion to adjourn.
All in favor, say aye.
Aye.
Meeting's adjourned.